right, thank you all for coming. Please join me in welcoming authors of The Alzheimer's Diet, Richard Isaacson and Chris Ochner.
Hello, welcome, welcome. Thanks so much for being here. It's nice to be back home from Comac, not too far down the road. A little snow on the road, so I really do appreciate you coming out, getting here safely. Dr. Christopher Ochner, he's from down the other side of the road.
Other side of the island, actually.
Yeah, northern Jersey part of the island.
Don't hold that against me.
So we really appreciate you coming out tonight, and we'll try to make this as interactive and informative and educational as possible. Also want to say hello to all of our followers and fans on Facebook. We're going to be streaming this event live on Facebook. If you are watching or listening on Facebook, please feel free to enter in your questions, and we'll start off with a little general overview, and then please feel free to ask questions. We'll take, you guys get first priority, you drove here, and then everyone else on Facebook will answer those questions too. So my name is Richard Isaacson. I'm an Alzheimer's specialist. I'm a neurologist currently at the University of Miami Miller School of Medicine. With Alzheimer's disease, for me, it's personal. I have 4 family members that have been diagnosed with Alzheimer's disease. My Uncle Bob was the first person diagnosed. This was back when I was in high school, many, many years ago, back at good old Comac High School, not too far down the road. And that's when we had how many treatments 15, 20 years ago for Alzheimer's disease? Zero. Yeah, we had absolutely nothing. Now today, we've made progress. Okay, we still have a long way to go, but we've made progress. We have 4 FDA-approved drugs for the treatment of Alzheimer's disease. We have tons and tons of data coming out, not just on drugs, but also lifestyle modifications. We now know that exercise, diet, the topic of our talk today, and other things too. So I think that actually 2013 is going to be a very exciting year. The last 12 months in Alzheimer's research has really been spectacular. Dr. Ochner and I, we've been fortunate. We get to go and speak at a lot of different Alzheimer's conventions. The last Alzheimer's convention was the Clinical Trials in Alzheimer's meeting in Monte Carlo, Monaco. And where are we going in a couple weeks?
Florence.
Florence. So we'll be speaking at the ADPD meeting in Florence. And at this Alzheimer's meeting in Florence, for the first time ever, we're going to be speaking, I'll be speaking actually, on a very interesting topic, nutrition for Alzheimer's disease at an international conference. Okay? For the first time ever, 2 years ago, there was actually a category at the Clinical Trials in Alzheimer's meeting on nutrition and Alzheimer's disease. This year, the number of research that was presented increased by 400% in the area of nutrition. So we're really excited that this is finally, diet and Alzheimer's disease can be said in the same sentence. Okay, there's no one magic bullet, there's no one magic cure when it comes to Alzheimer's disease. But it is my belief that we have to take a combination of interventions. I treat every patient as they're my own family member. Okay? You can't just give someone a magic pill and think that Alzheimer's is going to go away. Okay? We need to attack this from every angle. I'm a peaceful kind of person, but it's kind of like a war. Okay? You can't just win the war with one branch of the military. You need the Army and the Navy and the Air Force and the Marines. My dad was in the Coast Guard. My Uncle Bob was in the Navy. Okay? We need help. We need special forces. We need the CIA. We need every single person in every single avenue to fight Alzheimer's disease. It's a tough disease. It's a very, very, very difficult disease, but I think in 2013 we've made tremendous progress. So I think I'll stop there. I'd like to introduce Dr. Christopher Ochner, formerly he's a Columbia-trained nutrition expert. He's now on faculty at the Mount Sinai School of Medicine in New York. And Dr. Ochner, take it away.
Thank you, Dr. Isaacson. So I'm going to cut through and not cover most of this, but just want to say a few things. Talk to you a minute about a little bit about dieting and a little bit about where most of us get our information on dieting and nutrition. Okay, so I'm really a hardcore scientist guy. I really do the research and beg the government for money to give us more money for the well-needed research that we need more of, certainly. And so I've spent the last 14 years with my nose buried in a lot of medical journals, okay, and that's really where my focus has been. So I've largely ignored a lot of this stuff on the internet until, we started trying to get the word out there to more people. And so now, between the blogging and the book and Facebooking and stuff like that, I've really started to pay attention, be very interested in what's out there and what people are saying about nutrition and about Alzheimer's disease, okay, and it's come to some realization that I don't know if anybody has discovered yet, and I don't want to alarm anybody, but it appears as though not all of the information on the internet is exactly accurate. I know, I was shocked too. So I really do want to caution people and, you know, encourage you to be very vigilant. And some of this stuff is done in a very clever way and in a very sneaky way, and people with agendas and trying to sell things. So just be cautious of where you're getting your information, okay? The problem, to me, one of the major problems is that, you know, you have this relative sea of sort of agenda-full information on the internet, and then you have, relatively speaking, this tiny little pool of actual good, unbiased science where we really learn what works and what doesn't work and how to really help people. And the problem is that, for the most part, with relatively little exception, only nerds like myself get to see this little pool of solid evidence. Okay, there's really no mechanism, and Dr. Isaacson gets to see it too, but he's much cooler, so it's kind of an exception. But I really, truly, there's no real mechanism to get this information to the general public, the people that need it most. Okay, and that's where we come in. So we're trying to pull people out of the ocean and bring them into this little pool. Okay, so it's just a word on that, and then a couple words on dieting, and then we'll open it up for questioning. So when you think about dieting, somebody says, I'm on a diet. All right, what do you think of? What's their goal usually?
Weight loss.
Weight loss, right. Okay. So let's call that conventional dieting, right? Now, whether you know it or not, conventional dieting doesn't work so well, okay? Why? People typically don't stick to it, okay? So why do people typically have trouble sticking to diets? What do you think?
They're hungry.
Okay, hungry, not enough food. What else?
They reach their goal and then they stop.
That does happen sometimes. Go ahead.
They don't see results fast enough. So
Okay, that's a good one. What are most diets trying to get you to do when you first go on that diet? Change your lifestyle, how? Come on, don't be shy.
Focus your attention on what's appropriate to eat and what's not appropriate to eat.
Okay, change your lifestyle, exactly. By focusing your attention on what to eat and what not to eat, basically. And that's really the point, okay? Most diets are going to say, one way or another, eat less of this and more of that, right? The problem is that this is usually the stuff that we really enjoy eating, and that is usually stuff that we don't enjoy eating as much, okay? And so people, when we do this research over and over, we see the same thing. People can do it for a couple months and then they hit the wall, okay? They experience what's called diet fatigue, which basically just means they get sick of doing it and they go back to eating what they like to eat. I'm actually also a neuroscience guy, so I study the brain in reaction to food intake and stuff like that, okay? Now, eating pleasurable food, eating good tasting food is as pleasurable to us as sex and drugs, okay? Think about that, all right? So go out tonight and, you know, find a crack addict and say, hey man, how about kelp instead of crack from now on? It's not gonna work, okay? People are going to eat the stuff they love to eat, one way or another, all right? That's why with the Alzheimer's diet, we don't try to wrestle your favorite foods away from you, because we recognize you're not gonna stick to it, okay? We want you to make a change for the rest of your life, and we want to enhance the rest of your life, okay? So we hope it helps, we hope you enjoy it, and thank you again for coming.
Okay, so thank you. You know, as a physician, you know, I'm a classically trained physician. I have a medical degree in MD. I did a 6-year medical program. I then followed with a year of internal medicine, 3 years of neurology training, 2 years of Alzheimer's fellowship, and I'm a board-certified Alzheimer's specialist. That's all I do, 100%. In my medical training, how many hours of nutrition education did I get?
0.
Okay, not that much. 4. I can recall 4 solid hours, 4 separate lectures specifically about nutrition in the brain. Hey, we're making progress because the new medical students, they have like a week or 2. Not bad, in 4 years, a week or 2. So, you know, when you hear about diet and Alzheimer's disease and nutrition and Alzheimer's disease, you don't hear about that too much, but it's not your doctor's fault. Your doctors, I admire the physicians out there. I'm in an academic setting. I have an hour to see every patient. I'm subsidized by funding, and the Miller School of Medicine helps. And in the real world, we don't have that. If you have 10 to 15 minutes per patient, how can you expect to not only see a patient, provide quality care, and pay the rent, and pay back your medical school student loans? It's not easy. Diet takes a long time to understand and educate, okay? Reason why we wrote this book specifically is because there was not enough education going on. Knowledge is power, and education is key. So I hope the things that you asked tonight inform you of really the things you wanted to understand, and hopefully you learn from each other. We really look forward to answering your questions. Obviously, we're here all about diet. You can ask really anything you want. Any of the hard questions, we'll go to Dr. Ochner. Easy questions right over here. I think one of the most common questions we get is, there is no proof that diet can change anything with Alzheimer's. This is hogwash. Well, guess what? 5 to 10 years ago, it was hogwash. Now we have evidence. Now we have proof. Things are tough to change in medicine. The tide changes slowly. Remember a couple of years ago, back decades ago, diabetes? Oh, diet didn't help for diabetes. Diet doesn't help for cardiovascular heart disease. Now, is that commonly accepted? Well, in 5 or 10 years, diet will be a commonly accepted therapeutic choice for Alzheimer's disease. You heard it here first. Okay. So with that, I'll open up the floor to questions.
Absolutely.
So what we're gonna do is we're just gonna have a handheld mic. If when
Okay.
you pick someone, we're gonna give them a microphone.
Perfect. Okay, sounds good. So
Perfect.
we'll circulate the microphone, and we'll start here, and then we'll head over to Facebook in a little while after a few questions from the live audience. So first question, right over here, Mike.
My, can you,
Mike's okay. Great.
my mother has been showing some signs of forgetting, not being very focused. She's in her 80s, mid-80s. And I've done a lot of reading about plant-based nutrition, and one of the things that she loves is rice crackers with different types of cheeses melted on it.
Okay.
Something like those cheeses, from what I've read, not great for the body. Is there anything about animal protein, about dairy, that you have found that shows that it's not the best thing for people to eat?
Okay, maybe I'll start, but then I'm going to defer to Dr. Ochner for the rest. This is a really important question. I think number one, you said that your mom is somewhere in her 80s, okay? And I think if we look at statistics, okay, common things happen commonly. Just for education, not all dementia or not all memory loss is Alzheimer's disease. Common things happen commonly. The number one take-home point here is, if your mom has symptoms, see a qualified medical professional, see someone. Alzheimer's disease is nothing to be ashamed of, scared of, afraid of, because every minute that you delay in getting a diagnosis, getting a workup, is time really lost that you can intervene. So I'm glad you brought this up. That's number one. Number two, you can look at that food in different ways, and we talk a lot in the book about, not just saying, cheese and crackers, but you said a rice cracker with very specific types of cheese. And when you look at a meal, you can make each one of those components of the meal brain healthier, and that's our philosophy. In my clinical practice, I put patients on a diet, an Alzheimer's diet, and we track progress over time, and we look at the food components. So I'll pass the question, because when you look at the food components, what do you think of a rice cracker, and what do you think of that type of cheese?
Sure. I think it depends, okay? If that's all she's eating, or she's eating immense amounts of it, then you want to try to intervene. You want to try to get her to get something that she finds as pleasurable, that's as good to her, that she can substitute. If she's having one once in a while and she really enjoys that, that's great. Then we would suggest making some changes elsewhere, right? Overall, we're going to recommend, for things like cheese, if you really enjoy a really good cheese, okay, that's a tough one to go low fat or fat free, because you can taste that. If you're using it in cooking, that's one of the avenues we might take to make it maybe lower saturated fat intake. And we were discussing before, there's a lot of debate about saturated fat and the role of saturated fat now. There's some that say you need more. Conventional wisdom says that we want to limit it, and that is still the belief that we go with and the philosophy that we encourage in the book. So we do want to limit the saturated fats, and so it's just a matter of looking at how much fat is in that cheese. Okay, how much saturated fat, and again, if you really love it, if she really enjoys it, let her have it, and perhaps make up for it elsewhere. I don't know, does that answer your question?
Yeah. I think one thing also, I think this one's on too. I think one thing also is it's all about components, and I agree. Make brain healthier choices when possible. If that cheese is the most exquisite, whatever fancy type of cheese you buy in the nice part of the grocery store, and your mom loves that cheese, don't deprive her. You want to make, as Dr. Ochner says, the brain and belly happy at the same time. And if it's in moderation, my mom taught me everything in moderation. If she loves cheese and it's a high quality cheese, let her have the cheese. But it's all about amounts, and it's all about total amounts, and it's all about understanding what that cheese and what that rice cracker is made up of. I'm sure we'll talk about this more, but you said rice, and white rice, for example, and rice is a carbohydrate. And some of the research that we'll be talking about and that we've looked at ourselves is carbohydrates, and the connection to carbohydrates to Alzheimer's disease is striking. So a rice cracker, 1 or 2, no problem. But a whole bag of rice crackers is bad, in my opinion, for the brain. People think that carbohydrates are good or bad. They're empty calories. White rice, empty calories. Sugar, empty calories. And we'll go through this a little bit more. So again, it's about how much of this is she eating and how can you make the different components brain healthier. Okay? Okay, next question.
Hi, my dad's 74, and he's been diagnosed with Alzheimer's. He's currently on Aricept. You'd said there were 4 treatments for Alzheimer's. Besides Aricept, could you name the other 3?
Sure, great question. So the question is all about the current FDA-approved treatments or medications for Alzheimer's disease. And there's basically 2 families, 2 classifications. The diet book touches on this just a little bit towards the back. In the new book, we basically have the back of the book, the last 5 chapters or so, all about the treatment for Alzheimer's disease, as opposed to the first 20 chapters or so that are kind of bridging for both treatment and prevention, because there's separate data. In the back, this goes through this, but I'll give you an overview. There's 2 classifications. There's acetylcholinesterase inhibitors, long word, and then there's the NMDA antagonist. That's one medication, and then there's really 3 commonly used acetylcholinesterase inhibitors. That's the long word. The brain is made up of chemicals, okay? As we have Alzheimer's disease, the chemicals in the brain come down. We can give medicines to help boost up some of those chemicals. So Aricept, the generic name for that is donepezil. Donepezil is indicated for mild, moderate, and severe Alzheimer's disease. It's used to help memory and other thinking skills, but it may actually help other things too, based on some of the data that I interpret. Aricept, donepezil, is available as a generic. It starts at 5 milligrams. You then slowly taper it up to 10 milligrams. And there's even a higher dose, although I don't tend to use the highest dose too much. And the take-home point with this medicine is it works based on clinical trials, but you have to start low, go slow, and I recommend it in my clinical practice with food to minimize the likelihood of side effects. Some of the sisters of this medication is called Exelon, or rivastigmine is the sciencey name, and this is available in a patch formulation. It starts at 4.6 milligrams. After a month, you go to 9.5 milligrams, and then the newest dose is 13.3 milligrams. There's another medication called Razidine, or galantamine. If any of you guys are, any of our family members, patients, friends are cared for at the VA, the Veterans Affairs Hospital, that's kind of the drug of choice used at the VA. That's one classification. For mild Alzheimer's disease, you start with one of those. And as the patient progresses over time, you can actually then start the other class called memantine. That's the sciencey name, or Namenda. And Namenda is FDA approved for the treatment, the combination treatment with either Aricept, Exelon, or Razidine, plus Namenda for moderate to severe disease. That's a basic overview. How does diet play in? Because we can always talk about diet. There was actually a study, a randomized, double-blind, placebo-controlled trial. What does that mean?
That's really good.
That's good. Okay, that's good. So randomized, double-blind, blah, 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 whatever it is. That just means in science, he's the dork, I'm the cool one. That's what he said. That just means in science terms that it's a good quality study, a rigorous study. There was a small study done in 2008 showing that the cholinesterase inhibitors, like donepezil, Aricept, when used in combination with a B vitamin, like folic acid in sort of low doses, 1 milligram, you can increase the effectiveness of the cholinesterase inhibitors. So this is an interesting little point. It's a small study, but it underscores the importance that drugs only work as well as drugs work. They're not miracles. I use them in my practice by far, and I believe in them, and I think they should be the standard of care. But again, it's not just all about one magic pill. Maybe a little B vitamin may help that Aricept work better. Maybe the exercise will lower the bad stuff in the brain called amyloid, and then that would make other things work better. And you change your diet, and you decrease inflammation, you do this, this, and this, and that is a way to help yourself and help your dad to make that medication work for him a little better. Okay, sure thing. Take one more question, then maybe we'll go to Facebook. Up here in the front.
If Alzheimer's runs in the family, does that mean that all successive generations are automatically going to get it? I know that with cardiovascular disease, just because it runs in the family, a proper diet, proper exercise can reduce the possibility of getting a heart attack.
Gotcha.
The same thing with Alzheimer's.
All right, so I'll probably handle this one because I have several family members, so I've really studied this. So the question is all about, genetics. What's the #1 risk factor for Alzheimer's disease? No, you studied. What's the #1 risk factor for Alzheimer's? What do you think?
Age.
Age, you got it. Do we have any prizes?
We do.
We have we have prizes. We have
Look at
we have
that. It is a copy of Dr. Isaacson's
It's-
first book.
Who got it?
Alzheimer's Treatment, Alzheimer's Prevention.
Good job. Hey, nicely done. It's no, that's I signed this later. And remember, we do have brain healthy snacks in the back. A little later, we'll teach you a little bit about how to read nutrition labels and why we chose the brain healthy snacks that are back there. So that's for prizes too. But when it comes to Alzheimer's disease and risk factors, #1 risk factor is age. I know I live down in Florida. I haven't found the fountain of youth yet. Right? A lot of Botox in Florida, a lot of stuff like that. Haven't found that. But age is the #1 risk factor. What's the second risk factor? Probably / maybe genetics. Okay? The key take-home point here is, and this is stuff you may not read in the text, but you're not going to find this on the internet clearly. You're also not going to go to Dr. Google like I go to. Do you guys go to Dr. Google? No? Okay. You're not going to read this on Dr. Google either, but genetics are not a perfect test to diagnose someone with Alzheimer's. Okay? You can do a genetic test, and you may have a gene, but you may never get the disease. Okay? It doesn't exactly matter, in my opinion, and I don't advocate for genetic testing in my practice because, okay, so you have a gene, then if you're 85 years or older, you have an X% chance of getting it, but you're not 85 years or older. So you can't adequately predict. What I use genetics for, and this is not something commonly used, I actually wrote one of the first papers on this in the neurology literature in Alzheimer's and dementia in something called Continuum back in 2011, where we do a genetic test to make a treatment decision. Okay? This is a little complicated. It's something called pharmacogenomics or nutrigenomics. And I'm using big words here, but it's important to understand this. Nutrigenomics means I'm going to tell Mr. Jones to eat this or this because of the gene that they have. But Mr. Smith, I'm going to tell him to have that and that because they don't have that gene. So what we're learning, and this is hot off the press stuff, and you're, again, not going to read this in too many places. It's in the book. It's in chapter 15 or something. But we, in the future, will be able to make treatment, therapeutic decisions based on genetics. Today, we don't use genetic testing to diagnose. Yes, there is a family predominance. Early onset Alzheimer's disease is a little bit higher when it comes to genetic risk. Late onset Alzheimer's, sure, it's related, but there's like so many other variables. For example, if you have the Alzheimer's gene that many people know, it's called ApoE4. You may have heard about this. And for example, you have multiple head traumas. So heard about the stuff going on in the NFL? Okay, I care for 2 retired NFL players. They both have the ApoE4 gene, and they both developed Alzheimer's disease or dementia, whatever you want to call it, because we don't know exactly what it is with all the new science, many years before they should have. So multiple head traumas plus ApoE4 equals bad. Okay? So genes is not the only story. In my opinion, and I think Dr. Ochner would agree, it's not just age, it's not just genes. It's probably because of, well, we can now make more accurate diagnoses because we're more sophisticated. But what do you think that other cause of increased risk of Alzheimer's or increased cases of Alzheimer's is? What do you think?
Picking the snake?
Possibly. I think we both agree it's diet. And the Western style diet has changed really, I think, medical outcomes in this country. And when you see other countries that adopt the Western style diet, their diseases start looking like us. In India, right, they ate a lot of antioxidant spices, curry. Their level of Alzheimer's is quite low. When there's pockets in India that have high Alzheimer's disease, well, wonder why. It's not genetics. It's not it. It's not age. They're all aging the same, but it's the Western style diet. If they're more affluent, they start eating differently. So in my opinion, it is multifactorial. There's not like one magic way to figure this out, but it's not all about genetics. Okay, do we have any questions? Maybe let me just see if we have any questions on Facebook. Any questions on Facebook?
It's not coming up on our thing.
Okay.
Maybe if you want to check your phone, it's
Okay.
coming up there.
Okay. Okay. So we'll keep going in the audience then. Right up here. We'll wait for the.
Have there been any advances in diagnosing the disease? My understanding was you have to first rule out everything else, and if they're all ruled out, then you call it Alzheimer's.
Okay, good question. So this question really revolves around how can we diagnose Alzheimer's and have we made any advances? I still diagnose Alzheimer's disease the old-fashioned way. I talk to the patient. I think talking to the patient is the best way in 2013 to at least start the process. However, in 2013, we now have fancy tests. Okay? Talking to the patient is important and getting the history, progressive short-term memory decline, problems with memory, and then you do a lot of other tests. You make sure the vitamin's okay in the blood and the thyroid's okay and all these other things. You do typical blood tests, typical images. You have to do an image of the brain. The American Academy of Neurology says you have to do either an MRI of the brain or a CAT scan. I usually do an MRI. That's the typical way that most 99% of physicians are diagnosing Alzheimer's. The take-home point here is we've made a lot of cool advances. There's actually a new PET scan, PET, like a PET, stands for positron emission tomography. You can inject someone with a substance that will actually go to the brain and label or light up when there's that bad stuff called amyloid. You've heard about that? It's called an amyloid. It's basically an amyloid PET scan. Now, I don't use that yet in my practice. It's FDA approved, but it's not reimbursed by insurance. This is something that may change things around in the future, and people may use it more. It's not reimbursed by Medicare. It probably won't be for a while. But we're getting much more sophisticated. For me, I go by the clinical diagnosis. It's not easy. There's only one way to know if someone truly has Alzheimer's, and that's to take a piece of their brain. And I tell my patients, hey, Mr. Smith, want me to take a piece of your brain? Got my knife and fork from lunch over here. And they usually, almost every single time, okay, every time say no. So I treat based on my clinical diagnosis. I think we do have a question coming in from Facebook. Okay, we'll grab this one. So the question is, what kind of effect does lots of candy and sugar have on the disease? What a great question, Dr. Ochner.
Really bad. We do spend a lot of time in the book talking about sugar and carbohydrates more or less to your body. It's basically the same thing, right? And I have to say, if there was #1 recommendation, it's to cut down those carbohydrates, okay, particularly those refined carbohydrates. A lot of it has to do, it's a little bit complicated. I'll try to run through it quickly. So, you know, you've all heard that the refined sugars, right? The white pasta we talked about before, the white rice, the white bread, those are the ones that we should stay away from. Why? It has to do with glycemic index, okay, or glycemic load, and you've all probably at least heard that term, but what does that mean, okay? It has to do with your body, basically the level of sugar, okay, let's say the glucose, coming into your body from the food, okay, and that's going to cause a commensurate, right, or an equal rise in your insulin levels, okay, and the insulin your body needs in order to be able to process that sugar properly, okay, and not have it stick in your body and cause all sorts of bad things. So when you eat a whole bunch of sugar, a whole bunch of that refined carbohydrate, you're going to get this massive insulin spike, this massive glucose spike, this massive insulin spike in your body. Okay, it's sort of like, we use the analogy of a furnace. It's sort of like having a furnace that you want to keep burning. You want to keep burning it steadily. Okay, but with these refined carbohydrates, you're basically just feeding the fire with like paper. Okay, you're going to get this blustery flame. It's going to flare up and then it's going to die down, and you're going to need to feed it again. So then you put more carbohydrates, and it flares up, and it flares down, and it flares up, and it flares down. Okay, so what happens? Your body kind of gets sick of trying to regulate it. It's up, it's down, it's up, it's down, it's up, it's down. You get some dysregulation. Okay, and this is what you hear about when you hear about things like insulin sensitivity, okay, and dysregulation of your insulin sensitivity. This happens in the body, okay, and that can lead to diabetes, right? This also happens in the brain, all right? Your brain needs to regulate its insulin levels, okay, and be able to properly process that glucose. And so you get this dysregulation, especially in areas of the brain that are responsible for encoding new memories, okay, the hippocampus of the brain. So that's why, a big part of the reason why with Alzheimer's disease, old existing memories are preserved, but those new memories don't take, okay, that's a big part of the reason why. All right, so we know that high carbohydrate diets are really bad. They lead to, this dysregulation of the body's insulin response, insulin insensitivity, and also inflammation. And do you want to say any more?
Yeah, I think, when I teach my patients, and I'm lucky, I have an hour for every patient. I'm very lucky. But if I had 5 or 10 minutes, like the rest of the world of treating physicians out there that I admire, I would say, number one, there's good carbohydrates and bad carbohydrates. Okay? There's good fat, bad fat. There's good of this, good of that. And not all carbohydrates are created equal. And the take-home point here is, when you overload with carbohydrates, it's going to make your pancreas secrete that something called insulin. Insulin in the body is released when you eat sugar. What does insulin do to the brain? In my opinion, and based on science, causes inflammation. Inflammation, aging, inflammation, amyloid, inflammation, bad. Okay? So there's better carbohydrates, right? Like fruits and vegetables. They have carbohydrates in them, but they're good because there's antioxidants and vitamins. The bad carbohydrates, the empty calories, white bread, sugar, and more sugar, and high fructose corn syrup, which is concentrated and makes that insulin spike. I think that's a good take-home point. When it comes to, nothing against the coffee shop next door or down the road, but those whatever Ochinos, right? A little bit of sugar in there, a lot of sugar in there. So when it comes to making brain healthy choices, minimize the bad carbohydrates, everything in moderation, but think about things in these terms, and you'll understand that sugar has an effect over time on the brain. Okay, next question. Maybe right up here. Let's wait for the microphone. Sorry.
Up here to your left.
Hi. I have a couple of questions. It sounds like you are recommending personalized nutrition. Who do you go to? There are so many doctors out there who kind of really look at what you're saying right now, and they don't take it seriously, at least a couple of doctors that I've gone to. So how do you know who to go to? Nutritionists, regular GPs?
Right. So I didn't take this serious. So the question is about, who do you go to for a personalized nutrition approach at medicine? I'm being honest. 2 years ago, maybe 3 years ago, I didn't take this seriously. I thought this was a little bit of this. I trained at a place that is as rigorous as it gets when it comes to science. Harvard Medical School, that's where I trained for neurology. My professors were professors at Harvard Medical School, and they didn't teach me this stuff. And then I went to Florida, and on my own, because of the limited treatment options, we have some treatments, but this is the stuff I started learning. And then I partnered with this guy, Dr. Ochner, Columbia Institute for Human Nutrition, and I read and read and read and went to conference after conference. I don't know exactly the best way to answer this question other than saying, number one, get educated and get informed. Learn about it yourself. And then number two, see a qualified medical professional like a physician, an internal medicine doctor, a general practitioner, a neurologist. See a dietitian or a nutritionist, a certified nutritionist, and you may not find the right person the first or second time. It's not easy, and I think the good news here is that in the next year or 2 or 3 or 4, not just physicians in medicine, but there are going to be companies and other initiatives that are going to be attacking this. You know, we do a lot of research, and one of the major projects that we're working on now is exactly on this. Once the research gets published, that's when people will start paying attention. So maybe you can comment a little bit too.
Yeah, no, it's a really great question. It's a really tough issue, and I think you're right, and you started out by saying we're probably not there yet, meaning there are not a lot of qualified individuals that can really do quote-unquote personalized nutrition, okay? The approach that we take with the book is, you know, personalized to a degree that it works for you. I think that's the most important thing. If you can make healthy lifestyle changes, right, that you can and want to stick with, well, that's personalized, okay? And right now, unfortunately, it is kind of up to the individual because, like we've been saying, there are really not a lot of qualified professionals out there that will sit down with you and will be able to, you know, with a whole lot of validity, say you should be eating X, Y, and Z. You know, there are people that'll do it and they'll charge you a whole bunch, but is the science really there yet? Another couple of years probably.
Right. And I agree. I mean, your doctors are not going to be wrong when they reply, what do you mean? What do you mean you can do a gene test and make a nutrition decision based on that? Come on, seriously. I mean, they're not exactly wrong. The data's a little murky, okay? There are very specific things. In Alzheimer's disease, a specific type of omega-3 fatty acid, DHA, probably works better if you're negative for that gene. This is personalized nutrition, making a therapeutic choice based on your gene. There's a medical food that works preferentially. It's a prescription medical food that actually works preferentially if you're negative for that gene. There are other drugs out there that have been tested a long time ago. It's not available anymore, called rosiglitazone, another signal. The newest vaccines. Imagine that. If you're negative versus positive of the gene, you have a response. We don't have data. The FDA does not say you can make treatment decisions based on genes. So based on that, you have to go with what your doctor says. And unfortunately, we're not there yet in education. I'm going to take maybe one more question on Facebook. There's tons of questions on Facebook, so then we'll stick with the audience for a little while, promise. Let's see. Next question. My mom is 72 and has been afflicted with dementia since the age of 60, so it's 12 years. She was diagnosed with early onset mild dementia, Alzheimer's, and has IBS. I'm going to interpret that as irritable bowel syndrome. Okay? So irritable bowel syndrome. Is your diet compatible with irritable bowel syndrome? Does everyone in the audience know what irritable bowel syndrome is? Real briefly, it's a murky diagnosis. It's a tough thing. It's basically where you have a sensitive stomach. It probably is related to several things. I'm not a belly doctor. Don't play one on TV. I don't understand it as well as I could, but it's basically a sensitive stomach due to a variety of reasons. Great question. I like being challenged. I'll start with one sentence, then I'll pass off to here. Irritable bowel syndrome, you basically have to be careful what you eat. And for example, we recommend a diet rich in fruits and vegetables. And a lot of the ways to get all the vegetables and nutrients you need would be through, for example, a juicer. I never liked kale, gross, green, gross. But then I learned, if it's green, eat it. It's a great recommendation. But when you have irritable bowel syndrome, you can't eat too many greens, right? So one thing you can do is you can put stuff in a juicer, but you're going to have to sip very slowly, and you have to be very careful about the fiber. You have to be very careful about the good fats versus bad fats. Irritable bowel syndrome is a tough condition to make generalized recommendations about because all the different causes are different. I would say parts of this diet are certainly compatible with irritable bowel syndrome. But when you have any other medical conditions that are related to the GI tract, the stomach, you have to be very careful with any dietary changes, and I would always advocate before making any dietary changes to see and have a frank conversation with the treating physician.
That, for the most part, really covers it, okay? I mean, you know, we can't say, and we definitely don't want to say, yes, this is absolutely compatible for IBS, go at it. No. You've got to, if you have that condition, right, you most definitely, if you have not spoken to your physician and probably a dietitian, about that and figured out what exactly works for you and what does not work for you, you need to do that first and foremost right away. Then you need to apply that to any diet that you undertake, including this one.
Great. Okay. What question? Yep.
We cut out just for like a minute there.
Okay.
So you can briefly answer that woman's question again.
Gotcha. Okay.
The short version.
Okay. So sorry. Hi. So I guess for the face.
Sandy was her name.
Sandy. Okay. Hi, Sandy. This is interesting. I'm talking to the air, but I guess I'm talking to Facebook. How are you, everybody? So I'm sorry. I guess we had a technical glitch, so I'm going to repeat this answer very quickly. Irritable bowel syndrome is a condition where you have basically a sensitive stomach. Is our diet compatible with someone who has a sensitive stomach? The take-home point here is parts of it definitely are, but we would just have to be very careful and make changes in the diet much more stepwise and slow and under the supervision of a treating physician. Vegetables are a big part of our diet, but too much fiber, too much vegetables could irritate the stomach. As one example, anything you do, you just have to do slow and stepwise. A few more questions. Okay. So a few more questions up here. Okay. Oh, you? Yep, right there.
I am a vegan.
Okay.
Related to cancer. My husband's a vegan for heart disease, and we're familiar with a lot of the doctors and the China study and a lot of information, and we've been studying this for years and practicing it. As much as I'm a vegan, I still like a little glass of red wine at night, and I love that dark chocolate, even if it's, you know, and I have it over 80% or something like that. What are your thoughts about red wine and dark chocolate?
Great. Great question. I'll let you start, and then I'll continue. So red wine and dark chocolate.
That sounds perfect. So red wine, big component of the Mediterranean diet, or the Mediterranean style diet, right? Which there probably is, in terms of Alzheimer's, there is probably the most supportive evidence for, okay, and that it's good and it's neuroprotective, okay, particularly for individuals who are what we would call pre-Alzheimer's or MCI, mild cognitive impairment, okay. They show a big delay in the conversion or the transference from MCI, mild cognitive impairment, to full-blown Alzheimer's, okay. So, you know, what are the active ingredients, so to speak, okay? What are the mechanisms of action in the Mediterranean diet? We don't know yet, okay? Red wine is a typical component, it's a large component, and there have been some studies that very moderate, okay, glasses to a day, particularly of red wine with the tannins, can be neuroprotective and protective of memory over time.
There's actually a recent study by Neefsey and Collins that have looked into this, and ladies in the audience, you get 1 a day, and men, 1 to 2. Lucky guys. There we go. So, and is it red wine or is it 1 serving of alcohol? We don't know. We think, but like Dr. Ochner said, probably red wine may be a little bit better.
Maybe a little bit better. There was a beer study.
There was a beer study. I skipped the beer study. I just wanted to comment also about the dark chocolate. There was a recent study that was published just this past August. Okay, now I love dark chocolate. And in the book you'll read about this. I'm a chocoholic. I love dark chocolate. But the problem with dark chocolate is, even though there are potential brain-boosting effects, there's also sugar, 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 butter, 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 and then the dark chocolate when you look at the ingredient list. And one of the philosophies we teach in our diet plan is looking at and reading and understanding nutrition labels. The first thing listed on a nutrition label means that's the most heavily amounted in that concoction. So when you look at a dark chocolate bar and you see sugar and then butter and then sugar and then butter and then sugar and butter, you see the dark cocoa powder at the end. The most recent study looked at a very specific type of dark cocoa. Okay, I'm not trying to sell cocoa powder. I don't have stock in Hershey's and stuff like that, but I do like dark cocoa, and I put it in my coffee every morning. Actually, I have a packet in my laptop bag over there. When you can add dark cocoa powder, it was a very specific type. Actually, if you want to know about the type, it's actually on one of those websites, therapyformemory.org/vitamin or something like that. Go to the vitamin page; it's on there. I'm not trying to sell things. I just know that this specific type works. And they randomized patients. They put half the patients on dark cocoa powder and half the patients on nothing, a placebo, a sugar pill. And guess what? Dark cocoa powder, when you had 500 milligrams of cocoa flavonols, the high antioxidant properties, in patients with mild cognitive impairment, mild memory loss, which is the pre-Alzheimer's disease. Alzheimer's doesn't just start one day. It starts 20 to 30 years before in the brain, and that's why we advocate our changes 20 to 30 years before. I don't know if you guys knew that. But when it comes to dark cocoa, when you start before it's turned into Alzheimer's, mild cognitive impairment, 1, it improves memory, dark cocoa powder. Guess what? Number 2, improves blood pressure control. And number 3, ready for this? It improves insulin resistance. Insulin resistance, Dr. Ochner talked about that. If your insulin can work better, you're going to have less inflammation in the brain. And I believe that dark cocoa powder absolutely has to be an essential and mandatory part of a therapeutic plan for Alzheimer's disease. Okay, next question. Back there, the red jacket. Just maybe pass the mic.
If you are juicing, should you stay away from high sugar vegetables like carrots, since that I've heard can be actually bad for you if you juice and have this high amount of sugar in your system all at once?
Good question.
So, yeah, we're going to assume you mean vegetables, not steroids, right?
Carrot.
Yes, well, carrots specifically, you know, unless it's another reason, I know carrots are actually high in sugar, okay, and that typically is the reason that people stay away. So it might be considered like high glycemic index, okay, in fact I know it is. But the thing of it is, that's why personally I don't go with the glycemic index necessarily, I go with the glycemic load, because in order to get basically a lot of sugar, a lot of carbohydrates, you would have to eat like 4 pounds of carrots. Okay, so personally, no, I say don't stay away. I say carrots are fantastic for you. Yes, you're going to get a little load of sugar, but again, the amount, because the amount in the food that you're actually eating in carrots is relatively low.
So even with the juicing, you know it's more, it's okay.
Yeah, you know, we put patients on a low carbohydrate diet, and in one, 8 ounces of juice, of real juice from a juicer, you're going to get a lot of carbohydrates. But in my opinion, it's all about, again, the components. You're going to get a boost of the antioxidants, and you're going to get little high carbohydrates. For me, I'm okay with that. We, again, try to have our patients go on lower carbohydrate diet. In the book, we put people on a 9-week sequential diet plan. It's chapter 18, okay. And in this diet plan, the first week, you don't do anything at all. Successful, because all you do is read nutrition labels and you learn what you eat. In the succeeding weeks, we then try to decrease carbohydrates. You can have a big carbohydrate load from that juice, but again, it's all about balance, everything in moderation, and that's a brain healthy decision, and we advocate for that. We'll take one more question from Facebook and then one more question here, and then I think we may have to wrap up soon, but let's see here. Okay, next question. I've read that smoking and drinking coffee have been shown to possibly reduce the risk of Alzheimer's disease. Let's talk about this. Okay, so wake up and smell the coffee. There's some actually really great data. There's different types of data. There's the blah, 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 high quality stuff, and then there's the pretty good stuff. And the pretty good data on coffee shows that coffee drinking over a long period of time probably, not 100% sure, but probably reduces the likelihood of developing Alzheimer's disease or dementia. This is major studies done over 10 years in Europe. Now, they looked at 375 milliliters of coffee. That's not a venti, mocha, whatever, ochino, right? Dolce mocha, whatever it is there. So it's the coffee itself. So they recently did a study on, is it coffee itself, is it the caffeine, or does decaf work too? And what this study in mice actually showed that the caffeinated coffee worked the best. Several cups earlier in the day, not whatever ochino severals, little cups. In my patient practice, I recommend that it's okay as long as it's early in the day, not after 1 or 2 o'clock, because the caffeine can keep people up at night. Tend to agree?
Yeah, absolutely. Yeah, let's let me just do the smoking thing first. No, there have been some studies that nicotine might show a slight increase in cognitive performance, but that's pretty terrible idea, because you're getting a whole big bag of bad stuff along with it, so we would definitely not recommend that. Teas. Yes, there is not quite the evidence that there is for coffee yet, but they are doing those studies, and it seems that green tea and black tea may also have the same sort of neuroprotective effects. And we wanted to address coconut oil.
Yep, okay, and we have several questions coming in on Facebook. Have any of you guys in the audience heard about coconut oil? Who in the audience? Let's see a show of hands. Let's see a show of hands who's heard of coconut oil for Alzheimer's disease. So we have about 500 hands going up, and there's only 400 people here, so I guess everyone's heard about it. Coconut oil is a very interesting physiologic science-type way of innovatively treating or possibly preventing Alzheimer's disease. Let's talk about the good, the bad, and the ugly about coconut oil. Number one, coconut oil is not all created equal. You can go to the store and you can get X version, Y version, Z version. That's number one. So there are good, better kind of coconut oils and less good. The problem with coconut oil, though, is there is no regimented, well-designed scientific research to prove that coconut oil works. What's that called? A randomized, what's that called?
Randomized control trial.
Okay.
That is where you have a placebo, split up two groups, and one gets basically a sugar pill, and the other one gets the actual one. So you don't know what's going to happen.
Right. So I'm a sciencey guy, but I'm an open-minded person because I know we have to attack this disease with whatever we can. Is coconut oil bad? I wouldn't say it's bad, but in high amounts, it can potentially have a lot of fat and a lot of calories. Okay? The theory about coconut oil is ketones. And this is a theory that all of you in the audience will hear more about. Ketones as a therapeutic target for Alzheimer's disease. What is a ketone? Anyone know what a ketone is? The brain can use one of two things as a fuel source. The brain can only use two types of fuel, sugar or energy, sugar for energy or fuel, or ketone bodies. Okay, this gets a little complicated. We talk about this in the book, I think chapter 14 or something like that. But ketosis, ketone bodies, when you guys haven't eaten or drinking anything for 12 to 14 hours, your body is creating its own brain energy, and that's called ketone bodies, a natural low state of ketosis. There's actually a study that was done by those folks up in Boston, Harvard Medical School in the 60s, where they didn't give any food at all to people for 6 weeks. 6 weeks starvation. All they did, these were obese people, they gave IV fluids and a vitamin pill. That's all. And guess what? They lost weight and their brains still kept working because of ketosis. Ketone bodies, based on my reading of the literature, I think ketone bodies are protective. Can coconut oil provide ketone bodies as a fuel source for the brain? I'm going to say maybe, but I'm also going to say that we do not have enough rigorous scientific research to prove this. So therefore, at this time, we do not recommend coconut oil in our clinical practices. I'm not saying it's bad, I'm not saying it's good. I'm saying at this time, I don't have enough evidence. There are other ways to use ketones to protect the brain. Number one, mini fasts. And in the book, we talk about 12 to 14-hour fasts. What time do you guys eat dinner, usually? Oh, okay. So we're definitely in New York. We're definitely on Long Island because I'm from Miami and my family lives in Boca Raton, the early bird special. Save $1, well, you can also save your brain. If you eat dinner at 4, 5 o'clock, and then you don't eat breakfast again till 6, 7 o'clock in the morning, that 12 to 14-hour period, your brain is going to be subsidized, not by sugar, but by glucose. But not by sugar, sorry, but by ketone bodies, ketosis. So the brain can use an alternative fuel source. In addition, if you're not going to snack at night, which is really key, one of the main points in our Alzheimer's diet, you can reduce total caloric intake. People that have, in the Mayo Clinic study that was released several months ago, you lower the amount of total calories eaten, those people had the lowest incidence of dementia. Okay, in Okinawa, okay, there's something called, a philosophy called Hari Hachibu, eat till you're only 80% full. If you can decrease total caloric intake, where is the oldest living population in the world? Okinawa. There's more people that live to 100 in Okinawa than any other part of the world. Number one correlation, reduced caloric intake. So when you can have this 12 to 14-hour fast, and then throughout the day reduce those carbohydrates, it's a natural way of using your body's own backup system or ketosis system. There is a medical food, it's a prescription medical food for the dietary management of the metabolic processes associated with Alzheimer's disease. And this medical food that is available by prescription is a way to drink ketones. Okay, similar to coconut oil, but it's standardized, regulated, and there are clinical studies that have analyzed it. So I think the take-home point here is more research needs to be done, but this is a really exciting area. Maybe I'll let you.
I think we're getting the symbol that we need to wrap up, but
Gotcha.
I think that was an outstanding summary.
Okay. I guess last question. Yep. Sorry.
Charlie Rose, that they had this Dr.
Sorry.
Candell Mandel, who is a Nobel Prize winning.
Yep, he's up at Columbia.
He mentioned that there is a disease that's similar to Alzheimer's, often desired to be similar to that, that can be mistaken for Alzheimer when it's really something else. I don't remember the name.
So when it comes to dementia and Alzheimer's, Alzheimer's is the most common form of dementia. Around 60–70% at least of the time that someone has dementia, it's going to be Alzheimer's disease. There's several other causes, and I beg of you that if any time you have any sort of memory trouble, if you're worried, the sooner you get treated, the sooner you get evaluated, the sooner you can begin treatment, the sooner you begin treatment, the better you do. Whether it's Alzheimer's or something else, always seek the help of a qualified medical professional. Alzheimer's is the most common, but there's several other things besides Alzheimer's that can cause dementia.
Yeah, and I remember seeing something recently. There's a lot of reports of severe vitamin deficiencies mimicking Alzheimer's. Just know that it's really rare. It's not that if you're experiencing memory difficulties, it's certainly not that you have or are going to get Alzheimer's, but as Dr. Isaacson pointed out, much better safe than sorry. Talk to your physician sooner than later.
Okay, that's a wrap.
I think that's a wrap.
Take one. Okay, great. Okay, thanks so much.
Thank you guys for being here.
Okay, thank you very much.